Good morning, Jackie. Good morning, Faiza.
Good morning.
We will be starting at 9:30, so glad you're here. How's everything going in the semester?
It's been okay. It's been okay.
Good, good.
How are you doing?
I'm fine. I think it'll be interesting to see how many MIPSI students can come because the timing, is different than your program. Yeah. Was it difficult for you to come?
No, I usually have to drop off my brother in the morning. Thankfully today I didn't get like traffic or anything. His
Yeah.
school is kind of far.
Okay.
Yeah, but thankfully it worked out today. I thought I was gonna be late.
Well, good. Yeah, and also if you need a minute, like Anne is one of the speakers who's just come on, so I'll definitely orient the speakers. But yeah, welcome, Anne.
Good morning, Tam.
Hi,
Good morning, Faiza.
this is
And
Faiza and Jackie. Yeah, so they're students. Yeah, so I think as long as people, hi Jackie, as long as people's video works, you can sort of, oh, you look great, Anne. Perfect.
Kind of dark in here because I'm at home. I'll be going into the offices after this.
Yeah,
I don't
no,
want to risk getting caught in traffic.
I know it can get so stressful for sure. I think you look fine though. I think the lighting and the shot is fine. So great.
I'm going to step away.
Okay, go ahead. Feel free. Come back at 9:27. It's fine.
Will do.
Okay. Hi, Melissa. Jackie, feel free to step away if you want. We're just testing video, etc. But also welcome. Hi, Melissa.
I just realized I was on mute.
Hi. Let me, are you going to be on video or?
I am. I just gonna quickly eat my breakfast and then I'll get on video.
Yeah, good. Can we just turn it on to see it and then you can go off, like, just so that I know it, like how the shot looks, if possible. Oh, you look fantastic. Okay, that's all. You know how sometimes you just want to make sure it's all good. Okay.
Oh yeah, I get it.
Okay, cool. Come back at 9:27:28. Thanks.
You said what?
Come back at 9:27:28. It'll be fine.
Okay.
Okay, cool.
Pam, I unfortunately have to leave at 10 for a lit review for my lab,
Okay.
but I would love to watch the recording of what I miss.
Yeah, it will be recorded. I'll give it to Julie and then.
Okay. Thank you.
You'll definitely have access. Good morning, Daniel. Good morning, Claudia. If Daniel and Claudia can turn on their video, we can just test how it looks.
Morning, Tam.
Hi there. Oh, you look fantastic. Fantastic. Okay. If you want to step away, if you can, I just was testing video. We're going to all come back at 9:27. So if you want to check emails or do whatever you want to do.
Okay.
I had one question.
Yeah.
Who is our audience for this?
All right. Well, let me spend a moment and talk to you because I went over this with Claudia.
Okay.
At the pre-meeting. So Daniel, we have students from who are doing PhDs in gerontology across campus. So economists, neuroscientists, you name it, they're doing that. And then we also have people from our institute called Merrill Palmer Skillman Institute. And that is sort of people who don't study older adults, but sort of children. It can be infants, it can be teenagers, young adults, etc., or families, people who study family. They would all be part of the Merrill Palmer Skillman. So for the target group that like actually there's an expectation to attend these professional development seminars are those two groups of PhD students. So, you know, any tips on sort of working from a research capacity when a student wants to do a thesis or a dissertation, that's helpful. I have also spread this across campus, like it's been on our like basically Wayne Today and everything. So if we've been advertising it as any grad student can come. And so that might be people pursuing MSWs. It could be like I sent it to all our field people. So maybe they would even send if they're in internship today, just go to the seminar for an hour. I don't know. And then yeah, so I don't know if we'll have mostly research but when we did the practice the other day, we kind of designed the questions for, if you're coming in to ask, could I do a research project? But if you're coming to ask, could I volunteer with an agency, do it, and even interns? So your experience, of course, is a lot with interns and Lenora's too. So, so, you know, speak to that, like,
Yeah.
Yeah. Is that helpful?
Yeah, that's great. Thank
Okay,
you.
cool. Hi, Lenora, feel free to come back at 9:27 if you want to check emails or whatever. We're just testing the camera. Everyone's is working and then people are taking a little break, but
Okay,
let me
sounds good.
your sound is good. Your shot is good. Okay, cool.
Okay,
Come
all
back
right.
in 10 minutes. All right,
See you in a little bit.
super. Hi, Julie, welcome.
I didn't realize I was muted. Morning.
Oh, morning. Hi. Everyone's coming back at 9:27. So, you know, all good. But yeah, no, and all the speakers, their video works. So feel free to come back at 9:27.
Perfect. Awesome. Just saying
Cool.
good morning.
All right. Welcome, everyone. We'll start in a few minutes. Thanks for coming. Welcome, everyone. We'll start in about 1 more minute. Okay, well, I think we can go ahead and get started. Is that okay, Julie? People are coming in, but that's okay.
Yeah, I think that's great.
Yeah, we'll go ahead and get started. In the chat, I'm going to put the names of the program and the names of the speaker. I'll also, Julie, are you able to let the people in?
I don't have that unless you want to give me the,
Co-hosting privilege?
yeah.
Let me see. Well, I think that's difficult at this moment.
Okay, sorry, I can't do that. then.
Yeah, no. I think now I can. No, okay. I made you co-host now. Okay, I'll let you admit people if that's okay. All right. So on behalf of the IOG Training Institute, and we welcome the Merrill Palmer Skillman Institute trainees too. We are going to do a professional development seminar today. It should be quite interesting. It's called Engaging with Community Partners, Perspectives from Agency Partners. And I want to just inform everyone that you're being recorded. Some students can't attend today, etc. So please note that. We're lucky to have different people, which you have the list, but I'm going to ask them to come into the room, to introduce themselves more formally and their agencies. But I wanted to also just welcome and tell people who's here. So I think there are students doing PhDs where they're training to be researchers. I also see Randy Bushman, who's like the head of our field internships, so sort of how it's like working with students in a larger portfolio. I think a lot of us have different times in terms of internships or small projects or research projects that may be larger that you engage with agencies in the city. And so I wanted to do this program to kind of give us some ideas and tips from agency personnel themselves. I also wanted to do this program because in the pandemic, it's been very hard to have real contact. And I feel this real substantial. And I feel this program can also give insight in a way that maybe fills in some things because we've had less on the ground opportunities in the last few years. So my first question is, or to each of the persons, please introduce yourself and tell us what kind of agency you represent, and also what kind of clients or consumers you serve. If you know how many clients or consumers you serve in a year, let us know. But it's also interesting for us to know, for any one agency, there are lots of services. What kinds of programs, different kinds of programs does your agency offer? So I'm going to call on people because I think in Zoom it's easier. So I'm going to have Anne go first, then Melissa and Daniel from Hannan. They can share the question. Then I'm going to have Lenora go, and then finally Claudia. So hopefully that is less confusing. So Anne, would you take it away?
Good morning, everyone. I'm excited to be here and to join other panelists to talk about community partnerships. I'm Ann Holmes Davis. I'm Vice President of Planning and Program Development at the Detroit Area Agency on Aging. We're better known as DAAA. And we are one of 16 area agencies on aging in the state of Michigan and one of 625 in the country. And we provide older adults and caregivers, as well as adults with disabilities, with a range of services that help them to maintain their independence in the community. And that can range from direct services provided through our organization, which might include our INA call center, our information assistance call center, caregiver support services, nutrition and community health and wellness, MAP, benefit counseling, and that's to help people get Medicare and Medicaid benefits. We also have home repair and transportation services, and another a host of other services. We also fund about 120 organizations within the community, for-profit and nonprofit organizations that provide services, and it ranges from respite care and adult daycare to legal services and chore or home repairs. What we seek to do is to serve the older adults who are 60 years and over, in the case of Older American Act or state funds, in the cities of Detroit, Highland Park, Hamtramck, and Harper Woods, and the 5 Grosse Pointes. That particular service area includes about 153,000 older adults who are 60 years and over, but also caregivers and veterans and individuals with disabilities. So roughly around 300,000 individuals. We create a number of partnerships in the community in order to provide services and to test pilot projects that maybe will enhance or expand what we're doing to serve our targeted population. And we often work with students, researchers, and other community volunteers to do that. And what's been exciting for us is to work with Wayne State University, as well as the University of Michigan, Madonna University, and other colleges to sort of expand our reach and expand our ability to sort of pave the way for older adults by providing opportunities for students to get into gerontology. And I'll talk about that a little later. Right now, if you look at last year, we served about over 90,000 older adults and caregivers with services, and we served about 100,000 meals. We're best known for Meals on Wheels. And so we just want to help people age in place and help them maintain dignity during their retirement years.
Thank you, Anne. That was great. Great overview. I'll let Daniel and Melissa go next. They're from the same agency. I happened to be on a call with them this summer and I invited both of them. And but they offer different perspectives. So it'd be great if you gave your positions at Hannan also.
Okay, so I'll split our services. Luckily, we have enough programs that I'm able to do that. So my name is Melissa Draughn. I'm the Director of Social Work. I oversee the social work programs. A couple of them that I'm going to talk about is one of our adult day programs. We've served about 28 people this year through it. Of course, as time goes on, people cycle in and out of adult daycare for different reasons. We also have an AmeriCorps program called My Neighborhood Connections. And in that program, the My Neighborhood Connections members go out into certain zip codes around the city to help them connect with their community resources. And sometimes those resources are things that the community groups offer, and sometimes they're connected to us for different resources for social work needs, such as our emergency relief fund. And those are the 2 programs that I'm going to highlight. Daniel, take the rest.
Hi, I'm Daniel Horrigan. My title is Community Outreach Coordinator. I still don't know exactly what that means, but I'm a social worker. So I do, the program that I specifically oversee is our Active Connections program, which is our mental health support program for seniors. So we have a one-on-one counseling program. We sometimes use a brief intervention called Pearls, which is the program to encourage active, rewarding lives. It's a program designed for depression due to isolation. I also do a lot of groups in buildings, so doing sort of aging support groups in senior buildings throughout Metro Detroit. I also do case management, operating our case management program with Melissa. Our interns are involved in a lot of that. They're involved in all of our programs, but probably most heavily that and our telephone reassurance program. So we're calling right now probably about 100 seniors a week in partnership with the Detroit Area Agency on Aging, just to check in, say hi, reduce isolation, and provide resources and services when needed. And that's just what Melissa and I are talking about is just the social work part of our organization. We have this whole other side that sometimes gets to cross over. It's our arts and culture programming. So we have a really robust catalog of semester length courses for seniors of acting, drawing, dancing, drumming, painting, singing, you name it, they do it. We have a beautiful art gallery that focuses on themes that are relevant to seniors, or all the pieces are created by senior artists. So that's us at Hannan. Thank you.
All right, Lenora.
Okay, well, I would like to start first by just saying good morning to everyone, and I'm very happy to have this opportunity to meet with you today. The topic is just really outstanding, engaging with community partners, because that is our future. So I am the president and CEO of Judson Center, and I want to first say hello to Daniel and Melissa. I serve on the board of the Hannan Foundation and Hannan Center, so it's so great to see you all participating today and be able to share all of the great work that we're doing at Hannan. Here at the Judson Center, I have the pleasure of serving as the CEO, and I just want to share a little bit about the history. We first opened the doors back in 1924, so over 98 years ago. We are a nonprofit community provider that has grown over those 98 years. When I think about how we started really with foster care and adoption, and over those years, we've expanded into autism, disabilities. We've expanded foster care and adoption by adding mentoring and preservation programs. But we also have integrated care, which includes behavioral health, primary health care, and substance use disorder. We have offices that are spread over 5 counties. And it's amazing, when we first opened the doors in 1924, right there in Royal Oak, the corner of 13 Mile and Greenfield, and now having offices in Ann Arbor, in Livonia, in Flint, Michigan, in Warren, so in Farmington Hills, Royal Oak, as well as we have some programs, one grant that is statewide. We also foster care, we serve 37 counties. We provide foster care and adoption services. So I'm proud of everything that we have been able to do, being a community provider and really taking care of the needs of children, adults, and families. Think about over these last 2.5 years, all of us have had to live through a pandemic. So can you imagine people that may be diagnosed with mental illness, children that are diagnosed with autism, children that have been abused and neglected through no fault of their own, and trying to find housing for them, trying to find that forever family. Things have truly, truly increased over the 2.5 years. So when I think about other things that we're doing here with the Judson Center, it is so impressive of the work that we have been able to generate, and especially the relationship that we have with almost every university in the state of Michigan, where we have been very fortunate to have interns from universities, including Wayne State, to participate in different programs, especially on the behavioral health side and the autism, as well as within the adoption program. So once again, it is a pleasure to be here. And I guess a couple of the things I wanted to add was we provide services to more than 12,000 children, adults, and families annually, and we employ 400 employees. So thank you, and I look forward to spending the rest of the morning with you.
And last but not least, Claudia, who I've worked extensively with for years. Claudia?
Hi, good morning. I'm Claudia Sanford. I am with the United Community Housing Coalition. My title is Director of Housing Placement and Tenant Organizing. And yes, Tam and I have been working together on various projects, and I will describe what that looks like later. But with the United Community Housing Coalition, our mission is to work with low-income Detroiters who are at risk of housing instability. So that's a pretty broad description of what we do. We do that. We are, some of the main things that we do is we represent people in court. So we have a ton of attorneys. Everything we do is free. So if people are facing housing instability, especially as Anne has pointed out during Lenora has pointed out, and Anne, during COVID, we have tons of people who are facing eviction because of loss of income and various things that happen. So we go to 36th District Court, we represent them. And for those that we cannot stay in their current housing, because of the SARA money, the COVID Emergency Relief Assistance money, we were able to work out payment arrangements with landlords and keep a lot of people stably housed. But some people actually have to relocate. So that's where the housing placement staff comes in, and we catch those individuals and we work with them on finding housing. So generally the population that we get to work with, they come through the doors with multiple issues. So we try to help them out with jobs and getting their vital documents to get them, hopefully match them up with low income housing. Probably all of you know by now that we are the price of housing is increasing in Detroit. Incomes aren't going up. So there's a lot of people falling through the cracks. So we try to do the best we can to assist with that. A lot of that population has undiagnosed or diagnosed mental health crisis and trying to get that assistance. So it's a heavy lift for housing placement counselors. For tenant organizing, the organizers work mostly with buildings that are facing whole building displacement. And that's part of that is generated because of the sort of feeding frenzy that we have in Detroit, where people are coming in from all around the country and purchasing entire buildings and displacing the individuals whose rents were only in the last few years, just before COVID, rents were $450 to $650 in a lot of these what the city calls NOAA properties, naturally occurring affordable housing. Those are being purchased, and all those rents are going up to $1,000 plus. So there's very little place for our population who was already rent burdened to move to. So that's what we do with that. Now, we also have a mortgage and foreclosure program, mortgage and tax foreclosure program. And a lot of things that we do at UCHC, we've really taken leadership on. And even before we get funded for a lot of programs like our tenant organizing, we do the work. And then people see the work and people start funding us. So the tax foreclosure program is funded, I think, fairly well. And we have a program within that tax foreclosure program called Make It Home. So we actually have an agreement with the city of Detroit that if there is a renter who is living in a foreclosed home, they get the first right to refusal for that property for the cost of back taxes. So we've been making homeowners out of people who would not have qualified for home ownership in the past. We hold the deed, we do a land contract, we hold the deed until they pay this off. So if the house If the back taxes were $5,000, we put them on an easy payment program, which is probably usually less than the rent that they were paying. And as soon as they finish paying that off, they get the deed to the house. So this is a program that has actually gotten national recognition now because nobody else was doing this. Nobody else thought to do this. And so there are people who want to roll this out across the country. So it's really exciting. It doesn't change the fact that we still have the highest eviction rate and the highest foreclosure rate almost in the country. So we just need to fix some of those other problems in Detroit. So a lot of that's going to have to do with policy. So with people who are in land contracts, bad land contracts, and we know most land contracts are really not very good. They are weighted in the favor of the person who is selling that property, and most often the person who's purchasing that property loses big time. So we purchase land contracts, and we again do the same thing like we're doing in the Make It Home program, so that people get to keep their housing. So those are some of the things in brief that we do at the United Community Housing Coalition. We also have a smaller pilot program that's called Keep It Home. We are working in collaboration with the United Way, Poverty Solutions, and Detroit Housing Commission to give extreme case management to tenants for a year to help them stabilize their housing. And at the end of this sort of program, we'll reevaluate what that looks like. It's based on a program that was done in Boston that they had great success with called Home Start. So at the end of this, we are hoping that we can kind of make a case for the fact that to put more money into case management to help people stabilize their housing. So that is about the United Community Housing Coalition. I also represent a coalition of nonprofits and educators and nonprofit developers. And we formed a coalition back in 2013 called the Senior Housing Preservation Detroit Coalition. And that was in response to a displacement of about 120 seniors who were living off of Capitol Park in downtown Detroit on Griswold Street. And this has been a really exciting and strong coalition. It's all volunteer. Hannan House, DAAA are part of that coalition. We've been meeting once a month since 2013. And we've really raised awareness about the issues around seniors in Detroit and all the things that we bring to the table and that people take back to their agencies and discuss and take action on has really made, I think, really made a huge difference. We have not lost one more senior property in Detroit since then. We are currently advocating for additional senior housing because there's this silver tsunami that we're in the middle of. Years ago we said it's coming, but we're in the middle of this. We don't have enough housing, and for the seniors and the near seniors. And of course, for TAM is our relationship where we met each other. TAM has been vital in the helping us move that message forward through all the research that she does. And she grabs all of us, we publish things, we go out and make presentations together. So Wayne State University, Tam Perry has been a very strong part of this coalition since the inception.
Well, thanks, Claudia. Great transition. So first of all, I would say as research chair of this coalition and other stuff in the community, I've had the pleasure to work with every nonprofit except for Lenora's on this, panel. And I would say working and being in touch with people working in agencies has made me a better researcher in every way, from how you formulate questions, what questions need to be answered, what's important, et cetera. And then, you know, I also am very dedicated to co-publishing with community partners, and I've done it several times. So I'm going to go on to our next question, which is kind of a two-parter. I'm going to combine 2 and 3 for those on the panel. So when we think about community partnerships or collaborations between academic institutions and agencies serving in the community, what kinds of partnerships have you seen? But more importantly, for the students on the call, et cetera, how do you think the different parties benefit from these relationships? And also, are there ways to improve these partnerships? So again, you know, we realize that we all have different roles in the community, and Wayne State's right in the middle of you know, the city. But sort of what have you seen? So you can give examples of collaborations, and we really want to hear your perspective on it. Who wants to go first? I'll let you just jump in, I think. Anne, did you want to go first?
Sure.
Okay.
I just wanted to share a few things that we have worked on at the Detroit Area Agency on Aging in collaboration with some of our university partners, particularly Wayne State University. We're probably best known for the work we've done on our Dying Before Their Time series. We've partnered with the School of Medicine at 3 different times in 2003, 2012, and more recently in 2019, 2020, to try to determine why we're losing population. And we found that sadly, it's because we were basically having a situation where people were dying prematurely because of their health and not having access to care. And of course, some is tied into lifestyle change. So as a result of that training, that has sort of informed our agency, not only in its mission, but also in a lot of the work that it does around social determinants of health and other activities. More recently, we traveled to the U.S. Aging Conference in Austin this past July, where we received the Innovations Award after working in partnership with 2 of our wellness centers, St. Patrick's Senior Center and Neighborhood Service Organization. And with that Passport to Health initiative, we work with 3 universities, Wayne State University, School of Nursing, Madonna University, as well as Michigan State, 125 nursing students over a couple of years to make sure that we were driving older adults to those wellness centers to benefit from the evidence-based programs and other resources there, so that they could set SMART goals around their health and be assessed by a supervised nursing student, initial assessment, and then 1 every 3 months, so that they could benefit from those activities and then be incentivized to get awards after they created points, build up points for those activities. And we found that they were more socially engaged after benefiting from the program. The students had an opportunity to get some practical experience and to work with older adults. And interestingly enough, about 25% of the students, the nursing students, were interested in working with seniors when they came into this Passport to Health initiative. And about 58% were interested in having a career in gerontology after participating. So just having that exposure and getting that practical experience was beneficial for the university, for the community partners, as well as for the older adults. We've also worked with Wayne State on a long distance technology academy. We worked with the School of Medicine students who were not able to go into the homes because of COVID, but we identified the need for older adults to be connected to technology and training and devices. So we're able to work with them to develop curriculum around how do you use an Android or a smartphone? How do you use Zoom? How do you stay connected to your loved ones through technology, as well as how can you benefit from technology in terms of managing your blood pressure or managing diabetes? So those things are now on YouTube, and the students had an opportunity to make a difference in the community, and the universities and the community partners benefit as well. And what was interesting is that there's a lot of opportunities for students to come into these partnerships with some learning objectives in mind or some research in mind, and then build out their portfolio and also develop some long-lasting relationships with these organizations. Often they can land employment opportunities after their efforts. So those are just a few of the things that we've done. We've worked with students on our Food and Friendship Connections program, where we engaged them in helping us to build out our peer support. They came up with the idea of developing intergenerational relationships between older adults living with HIV and younger generations, so that the older individuals could benefit from the knowledge of the young person, and then the young adult could also reap some benefits and wisdom from the other individuals. So there's a lot of rich partnerships that can be developed that can assist an area agency on aging in enhancing and expanding programs that need to be out in the community.
Thank you, Anne. Lenora, did you have a few examples?
Absolutely. One thing about partnerships is extremely important, to know your community, look at how we can strengthen partnerships, because that really is our future. I think we're way behind, because what we're seeing nowadays is that people are really starting to talk. And it's good that that has happened, but it would have been great if it would have been years ago it had started. So when I think about here at Judson Center, we've partnered with Wayne State, especially when it comes to treatment foster care. One of the things in our line of business, especially on the foster care and the adoption side, we have a challenge with trying to place older children, and especially if it's older children that are facing a lot of challenges and difficulties in their life, and what happens to them when they age out. So one of the things through a research project that we did with Wayne State, taking a look at the state of Michigan, we are way behind in treatment foster care. And it's really going to be very hard to really get it where it needs to be. So we're working right now. We're trying to identify, foster parents that will be willing to engage in treatment foster care. So that's one of the things that really have put us out there through the relationship that we do have with Wayne State. We also have partnered with Oakland University as it relates to our autism program. We're doing research together. We're taking a look at, where are we in the state of Michigan with our children? It's sad to say the numbers are not getting better. They're going in the wrong direction. Probably 2 years ago, 1 in 56 children were diagnosed with autism. Today it's 1 in 44. So the number is not getting better. So we collaborate with Oakland University through their students. We've had students to come on board as interns where they can learn the things that we're doing, help them make a decision on how they want to continue moving forward, and if they want to become a board certified behavior analyst. So I totally agree that working with universities is where we need to be, in our line of business, so that we can make sure that we're positioning the agency for the future. But not only universities, we're in the schools. We're in the high schools, the middle schools, because they need us as well, providing the services that we do. So we partner with a lot of the schools. We partner with almost every hospital here in the state of Michigan. And it's because of the line of work that we do requires those type of partnerships to be in place.
Thank you, Lenora. I'm going to move us to our next set of questions. And it's really advice, because all of you bring such wealth of experience. So my question is, as individual students, either needing internships or doing research projects, approach agencies, what advice do you have when you approach an agency, when you work in an agency, and when you're exiting an agency? So, you can kind of give tips for any three of those examples. And I think when we were planning the panel, what was very important is to think about exiting an agency too. I'm going to start with Claudia. Claudia, feel free to relay any topics about the partnerships too, but I'm also really wanting your advice too. So jump in, Claudia.
Yeah, and this is a good question because it kind of piggybacks off of some of the partnership. We through the SHIP-D Coalition, one of our community partners is Authority Health, and Dennis Archambault is our person who comes to the meetings. And prior to COVID, he had an intern, and he asked Tam and I to kind of oversee the intern's work. And she was very energetic and very interested, and we asked her what she was interested in, and she said, you know, when she told us, we said, okay, we've got this thing that we've been thinking about for years. And we worked together to create this health and housing assessment tool. Now, the reason we did this is because of some of the things that Anne was saying. I believe it was what Anne was saying about, you know, dying before their time, is that because on the ground, when I'm doing tenant organizing, I'm in a lot of the buildings and I'm working with a lot of the tenants, and I get to see firsthand when, you know, you hear other people talking about people dying all the time by themselves in the properties. And I've had that personal experience working with people who I was trying to get housed. So we created this health and housing assessment tool, very intensive. And the idea was to look at the individual health of people in the buildings, and then to look at the building as a whole. So to say, this is the type of, when there was one building in Midtown Detroit where people who would come there would say, wow, I've never seen so many people with amputations or in wheelchairs in one building. And I don't know why it gravitated to that building, but different buildings have different characters of people who live in them. So that was something that was done by a student, and we are actually using that in cooperation with the Hannan Center. We have a grant that we will be over the next year, we will be conducting those assessments. So I think that is a fantastic partnership that we had with that particular student. And it's something that if people are looking to do some research projects with different agencies, this is something that I think would be, you can kind of see that you can actually do something that's impactful and meaningful and has a real result. So if you're going to, Tam, are we mostly on number 4, excuse me, for
Yeah, no, I think
okay,
it's really
yeah.
great. Approaching agencies,
Right.
or when you get into an agency, but approaching agencies, you had a lot of ideas.
So if you're going to try to go to an agency, you want to do something with Hannan Center or DAAA or something, walk in the door knowing something about that agency and not just knowing it from their website. Really do some deep dive research on what you're doing. Know that what you want to do is actually related to the work that they're doing at the agency. And that if you walk through the door and you talk to people, say, I have some knowledge in this, I've written some pieces about this in the past, or this is the personal story that I have from family or friends or something, but you need to put your best foot forward. You need to really understand, who you're going to talk to. As I've been doing a lot of interviews with people recently, and I'm always struck and surprised about how little they know about our agency. And that if they would, and that's the first thing that my boss, the executive director, asks them, what do you know about our agency? And then the questions are always kind of weak. When you are putting something on a resume, I think because we have so much information in our heads, we don't think to explain things a little bit better. So when somebody says, oh, I worked at such and such a place, I'm thinking, well, I have no idea what that place is, or what they do, or how that relates to what you want to do in my agency. So I think that to spend a little bit more time explaining that, I'm a student, these are some of the things that I've done and explain what that means and what that looks like and make that connection to what you want to do. So I think those are some of the things that I've seen. If you do get an internship or a job or working on a research with an agency, make sure that you always show up. If you say you're going to do something, do it. If you say you're going to be there, be there. It is really terrible for the agency to be sitting there and saying, well, so-and-so that said they were coming in today, but I don't know what's going on. I haven't heard from them. And then, I've actually had, people just sort of disappear for days on end. You don't know what they're going to do. They won't return calls. So I think that if this is a good way to understand what, and not to say that none of you have had real work, but some people really haven't. Some people have been, studying for years and years, and they haven't worked at McDonald's, and they haven't had, those, kinds of jobs that you think, this is a job I never want to do again in my life, so I need to move forward. So be there, show up, do the work that you're supposed to do. And then when you're about to leave an agency, make sure that you have the report. Ask for meetings, sit down with whoever you're working with, talk about what you've done, talk about what you like to do going forward. Turn in your project, and just make sure that you are leaving with the best connections that you have, because all of the people on this panel here have connections all around the city and in some cases around the state. And you can really make sure you will have people who will say, yes, I think you should hire this person or take this person into your project because they're awesome. They did such a wonderful job with us. I will let somebody else have a word.
Thank you, Claudia. Also, it is so true because I've been in all the meetings where agency staff talk and they say, oh, we had a great intern last year. We had a great student come through last year. I mean, very much the personal recommendations. I'm going to turn it over to Hannan, either Melissa or Daniel or both. Kind of, what happens when they're in an agency, any advice, we would take it.
Yeah, I have some thoughts, some things that would really behoove the student for internship or just life and career, especially when you're in social work. For those who are not in social work here, in social work, supervision is a big value to the field. So that means, having some one-on-one time, some form of that to check in with somebody about your work. When you're a student, this is something that is supposed to happen. And when you're getting your license, this is something that's supposed to happen. And then ideally, you're still engaging in this on some level, even after licensure. And I do find like a lot of students are really looking for supervision. At Hannan, where we definitely give supervision. But I think that students or new job applicants, people that are new to the field, that might be one of your interview questions. If you feel like you really do need that, and that's a value to you, asking, what does supervision look like at your agency? And if somebody says, I'll sign your thing, maybe that's not the place to go, if that's a value to you. So I just think that's something that we do well and that our students really benefit from. What I think our agency might benefit from on behalf of our students, and I don't know if this is something that's necessarily, I wonder if the universities could help with this, is sort of what Claudia was talking about in kind of job preparedness. We get BSW, we get MSW. So we do get some young folks, 19, 20, 21, 22, possibly haven't had a professional sort of administrative type of job. People who, maybe don't have a work history, and that's okay. People who have worked in retail, and that's great too, that's fine. But I wonder if maybe there are like modules on things like email communication, calendar keeping, professionalism, that might be helpful to the student who's new to the workforce. That would save me a lot of time and a lot of like sort of hiccups of like, well, where is this person? Did they have it on their calendar? Do they know how to use their calendar? Do they know how to use Google Docs? Like all these kinds of things that end up taking up time and aren't really a fault of the student. And it's fine to teach it, but we could be focusing on other things.
Thanks, Daniel. Melissa, do you have anything to add?
Yes, so just on the part about wrapping up, and it came to me because we had a student, not from Wayne State, but from U of M, who sort of left us because this wasn't a fit for her. So I just wanted to speak on that a bit. Like, I feel like not all internships are a fit for all interns, and sometimes interns push themselves through it just so that they don't have to find another one. I feel like that's a disservice to your experience because you only get so many internships before you have to go into the professional setting. So most of your experience is going to be on things that you're not going to do, or it's a place that's just not a fit. My advice is to talk to your liaison, talk to your field supervisors, like when you start feeling that, because we can either work to see if there's a fit, or you can start working to find another internship while still, giving what you can to the current internship. I will say that happened to us, honestly, just that one time, but she was upfront with all parties and she did her work while she was here. Like, it wasn't, I'm leaving so I can just coast till the semester ends. So I would say it's no shame, and there's no shame and there's no hurt feelings about it. The shame comes in when you push through and you don't give everything because you know that you don't want to be there.
It seems like one of the values I'm hearing is good communication. And I also hear from Daniel that sometimes people don't start out understanding what professional communication is, and that your internships or your research projects are places where you're still being mentored. Like, if you're doing a research project, you have faculty behind you too. But I think checking in when there's a bump in the road with mentors to try to help navigate it is also really important. Of course, like for any of the students under my sort of purview, I'm happy to talk, about sort of, because sometimes I think there's a way you don't know, I don't know how to interpret the situation. I'm going to open it up for questions from the audience, but also I want to make sure anyone else has it's our last question. Is there any way you can recommend or give last thoughts on how these student experiences for research or internships can be more fruitful from your perspective? And then if there are any questions in the audience, but I'll give Lenora and Anne and Claudia and Melissa and Daniel, if they have more, is there any way to have these relationships be more fruitful? Because they are part of learning. People are in formal programs to sort of have this learning. So I'll let anyone jump in with how can these relationships be more fruitful, and then take any questions from the audience.
Absolutely. Probably something I would like to add, and I totally agree with Daniel when he said professionalism. That's extremely important. When you go into an organization, even being an intern, it gives you an opportunity to really see what business setting is going to be all about. I think it also helps you determine exactly what you want to do in life. And especially if you have an opportunity to do an intern that's related to your field. What I like about what we've been able to do here at Judson Center is through various programs, we work with our interns and we are mentoring them. We are making sure that they're under the supervision of licensed staff. And our goal is to make sure that they love the organization so well that when they graduate, they already have an opportunity. So something I want you to know is give it your best, no matter where you may be, because you never know what that opportunity may end up being. And the feedback that we have received from a lot of our interns, if they spend 8 months, 12 months, a year and a half with us, they have really grown to know the organization and how we operate. So it's a good fit for them to become an employee. So give it your best.
I agree, Lenora. It's very important for student interns or researchers to go into that experience with the end goal in mind. You know, do you want a portfolio, something for your portfolio? Do you want to publish an article? Do you want to strengthen a skill that is lacking? So I think you really need to go into the internship experience with some things that you want to accomplish as a result of that experience, and then make sure that you're in touch with the individual field instructor to make sure you're getting what you need out of it, but also making it a win-win for the organization.
Anyone else? I will also ask if anyone has any questions from the audience, or did this, you know, this is very different than, oh, great. This is very different than sort of an academic talk. We're very used to sort of hearing about, you know, research projects. This is sort of like imagining yourself partnering in real organizations to collect data, or to sort of see if the questions that you're motivated by match sort of what people are interested in. Mackenzie, I see your hand first, and let me know if there are other hands. Mackenzie, and Deb, okay. Mackenzie first, then Deb.
Hi, so my name is Mackenzie Sprecher. I'm a first-year PhD student in the program here at Wayne. And I have two questions. I'll start with my more professionalism question, and then I have a question about the research that Anne is doing. So for professionalism, so my understanding is that like each organization is probably going to have a different idea of what that looks like. From your collective experiences, is it appropriate for interns and new hires to ask upfront about what the expectations for professionalism are within the organization, to, I guess, give the students an opportunity to meet those before they fall behind?
I would say absolutely. You know, I think it's good to ask those questions. And what I'm seeing more and more is that organizations are beginning to put it out there first and just talk about, because a lot of us need to know when we go into a workplace, how should we be? How should we carry ourselves? How we should be courteous, you know, how we should be respectful, you know, how we want people to know us. And it says a whole lot. And I would just encourage you, the very first impression people are really going to remember, you know, how you walk in, how you carry yourself, how you're engaging with others. So that helps all of us to really develop that professionalism that will be with us for forever.
One of the things that the Detroit Area Agency on Aging does is when a cohort of students or a student comes to our organization, they do have an orientation session with our Human Resources Department. And then after that, they're oriented to the department that they're going to be working with. So we're trying to sort of put it out there what those expectations are so that they're aware of them before starting the internship.
All right, and Mackenzie, did you have a second question?
I did. And so earlier you had brought up that your organization is starting to look into technology programming for elders to help them become more acclimated into how to use smartphones and that sort of thing. And I was just wondering if you could maybe elaborate on if there has been any resistance to that sort of programming in your clientele, and how you are dealing with, as an organization, the generational gap between student advocates and your clientele. I know that's not super related. I'm just curious.
Sure. As we experienced the COVID-19 pandemic, it became very apparent that there was a huge gap in the older adult population feeling comfortable with technology and having access to broadband and or devices and training. So that was one of the reasons why we approached Wayne State University about assisting us to develop technology. At the time, we received over 1,000 Chromebooks from United Way and some additional ones from several other sponsoring organizations. And so we wanted to distribute those devices, but we realized that many of these individuals did not know how to use technology. So that's why we started looking at this whole issue around the digital divide in particular. More recently, we have approached Wayne State University Center for Social Research to do a baseline study on what that digital divide looks like, and also how that impacts the social determinants of health. So we'll be working with Dr. Richard Smith, Tam Perry, and also Dr. Faith Hopp to look at that whole issue around that technology gap.
Fantastic. I look forward to reading all about it later on. Thank you
we'll
so
be
much.
working with social work students as well as medical students on this initiative.
Thanks, Mackenzie. I'm going to switch to Deb. Feel free to anyone else raise your hand if you want, but I'll turn it over to Deb for a question.
Hi there. This is Deb Habel, and I am clearly in my car, but I didn't want to miss a thing. I was listening while I was driving in, and I'm parked and need to go into the office, but that's okay. I'm not a first year. I'm almost ABD. I'm over in the College of Engineering, in industrial engineering, which sounds like, why are you on this call? But I'm on this call because I'm also a huge fan and volunteer for years with the Accounting Aid Society. And I'm also a CPA, and I teach here at the business school accounting. But I want to encourage students to not think only on the traditional social work type things. There is, and I guess think out of the box when you're looking at agencies to volunteer with and to become involved with. I am currently working with a professor over in the School of Public Health on a project with the Accounting Aid Society. And we are looking to determine what are the resistors that cause seniors to, despite the fact that they're eligible, that they're not required to file taxes, but that they're eligible for tons of credits that could be amazingly beneficial for them, why they still don't file. And, we have Accounting Aid has programs and, resources available to do this for free. And yet, people are still resisting. And we're trying to get in, and I think DAAA, you guys have probably been in contact with Accounting Aid directly about getting into some of the centers. We are, it's not necessarily your first thought about what a social worker might do, but you're improving somebody's life simply by helping them get a resource like getting their taxes finished.
Deb, I'm going to jump in.
Yeah.
To tell you that I received the notice yesterday from all my channels, and I put it in the chat for everyone on this forum, the link to the project. But I also agree that financial well-being, as we've heard from most people on this call, is a huge part of well-being. It just has to be. And so, it's hard to create more money, especially in days of inflation. But this new program that is clearly with the Accounting Aid and ARP and Wayne State is really about getting credits that you're just entitled to, right? So that's amazing. So I appreciate you coming on the call. And also that's one of the reasons I spread the word throughout campus so that we get students interested, beyond sort of the smaller communities. But I appreciate it.
Thank you. And I just have one actual question for the team. Okay. So as a nonprofit, when you're working on grants, you have a time delay, right? The grant is covering for a particular period. And we at Wayne, there's administrivia and things because of the pandemic, things have been much more difficult. How do you guys respond and work with your grantors to adapt or to, I guess, get yourself some leeway on that deadline? If there's a delay that's not necessarily in your purview of control. And I'll take that, I'll go mute here.
So one of the things that we do here at Judson Center, we have 4 grant writers, because you're right. Most times when you're responding to a grant, there's a deadline and they don't give you as much time as what you may need. So we found out that having only one person available was not going to be enough for us. So that's one of the ways that we've been able to address that, is making sure that we have the resources available, and to make sure that we can free up the staff that need to be involved in providing that grantor the information that is needed, to assist them in writing that application for us. But Deb, you're right. It's up under a time constraint. You don't have a lot of time. I've seen sometimes a grant come out and you got to respond in 2 weeks. So making sure you have the resources available to assist.
Try overnight.
Yeah.
I've been approached and I've had to literally write proposals overnight. And one of the things that we try to do is have a key individual, which is typically myself, and then we work in a team so that we can lean on various team members to provide various sections of the document that's needed or data. In addition, we maintain a template so that we have the typical things that they're going to ask for ready to go. So you have all those attachments already ready, and then you have background information about your organization, and you always are in a position to move quickly to get the job done.
That's great advice. Anyone else on grant funded projects? I'll just chime in 2 things. It's really important for people to realize that the university timeline is very different than agency timelines. So in university, we really think semester and then we take a break, semester and then we take a break. And we have to realize that the agencies, they will keep going no matter if we're on 2 or 3 week breaks or on spring break. And I think it's really important to realize that, even though the students have their own pressures of final exams, and they also often are also now TAing and they're grading papers, but in a lot of ways, agencies just keep moving. The other thing to think about is sort of how I like the idea of sort of having the template ready, because that's very analogous to thinking about writing articles, which is your first article is really hard to write usually. But then when you're on your 10th or 15th, it shouldn't be as hard, because you have some of the skills and some of the sort of templates in place on how to do things. And I would assume that that's the same as like being ready for grants, means that you also have this grant experience under your belt to kind of how to describe your programs, how to make a grant that's manageable for the dollar amount available, et cetera. I am going to ask for one last question, if there's any burning question, and then we will call it a day. Is there anyone who has another question out there? Let's see. Okay. If not, I would say I would just like to extend a warm thank you on behalf of everyone at Wayne State to our panelists. It's really refreshing to be able to gather you and gain your wisdom. Cumulatively, you have so much that you are doing in the community. And even though it took a long time to describe all your program, it's because your work and your impact in each one of the agencies is amazing. So we thank you for the opportunity to share with us today, and hope that everyone has a great day today. Take care, everyone.
Thank you. Bye-bye.